Hi, you've joined us for another episode of the Hawkins STEM Chronicles. Today we have a special guest, a very, very special guest. Most of the times when we do these interviews, we just have people tell us what their first name is. For professional reasons, though, I don't know if you want to tell us both your first and your last name.
That's fine. My name is Jennifer Rioux.
Okay.
Yeah.
And now, what is your profession? What do you do?
So I have a PhD in Medical Anthropology. I also have a credential in Ayurvedic medicine, yoga therapy, herbalism, and I have a postdoc in complex systems science.
Okay. So in other words, you're the right person to talk to. Okay. Now, what is a medical anthropologist?
Okay, so it can be many things. I mean, traditionally there are 4 to 6 fields of anthropology. People count them differently, but the 4 would be biological or physical, linguistic, social or cultural, and archaeology. So archaeology is the study of past civilizations and ancient times, and linguistic kind of speaks for itself, language and communication. Physical or biological is kind of more looking at kind of the evolution and development of the human species. And the social or cultural is very much looking at human behavior, human organization, how do people develop systems, why, how do they work or not work. And so I am a cultural and medical anthropologist. So I have a cultural social lens on all systems of medicine, specifically integrative healthcare within the paradigm of biomedicine, and also traditional indigenous medicines. And what is the relationship and the dialogue between the two?
Okay. So medical anthropology, therefore, is a field within the larger anthropology thing.
Yeah.
Let's talk about the medical piece.
Mm-hmm.
Now, first of all, why is that STEM?
Why is that STEM? Well, the most important thing I can say about that, which I, kind of repeat as often as I can, is that there's not one system of science. We have Western science kind of built up as if it is the pinnacle of science, but there have been a multitude of sciences across time and coexisting today more or less harmoniously. But it's very important for us to understand scientific pluralism and medical pluralism. We can gain so much from dialoguing with other systems of science and other systems of medicine and understanding their causal paradigms and how they understand assessment and treatment protocols. Western biomedicine is actually quite young in terms of thinking about medical paradigms, but oftentimes it's not as good at respecting its elders, if you will.
And I guess that's one of the reasons why academics write. Because that way, a document, you're doing research, and you have to understand a certain thing. And you go back and you look at other documents to really understand the research. And you could be reading something that was written back, I don't know, in the 1800s.
Sure.
But it tells a story, and you build on that, and you build on that, and you build on that.
Right.
So that's really important.
Yes.
Now, how does one become a medical anthropologist?
So, in most cases, you need a PhD. You can get a master's degree in medical anthropology, but most people go for the terminal degree. And so, that's the simplest way.
Okay.
Yeah.
Now, when you say terminal degree, what do you mean?
That means that's as far as you can go with that course of study would be a PhD. I did a postdoc, but usually a postdoc is more of a specialization.
Now, we're going to talk about that on another time.
Okay.
Because that's an important question. Probably shouldn't say this, but I have a relative. And I won't say which school he's at, but he's on the engineering faculty. And one of the things we were talking, not about this interview, but about another one, and we were saying, well, I really want people to understand either if they're not in STEM or if they're not in academics, what having a PhD means and the path to getting a PhD. And he busted out laughing because he's got a PhD in mechanical engineering. And his wife has got a PhD in something or other. And they used to teach at the same university, now they don't, but it is what it is. So he started laughing, and he says, yeah, because when I was an undergrad, I didn't have a clue about what it took to be a PhD.
It's a lot. It's a lot. I mean, a law school degree is 3 years.
Yes.
A medical degree is 4 years of school, and then 4 years typically of intern and residency training. And a PhD, I think the average number of years for a PhD is 7 or 8 years. So it's equal to the same amount of time spent becoming a specialist in your field as medical school or something like that. It's really a significant investment of time. And once you're done, you are perceived as an expert in, the very specific thing that you have studied. And, it's not for everybody because it does take a very long time to
get that done.
Finish, yeah.
So now, what kind of science did you need to take?
Well, I mean, there's all kind of science within the science of anthropology. I mean, some people will take statistics. Some people will focus more on qualitative research methods. I myself am a mixed methods person, but also a whole systems complex science researcher. And part of what that means is that when you're designing a study, you take into account the causal understandings of the paradigm that you're studying, and you design a study that is model valid for that paradigm. For instance, in the traditional world medicines, illness and diagnosis is considered multivariable. We have the same thing in biomedicine, but biomedicine is very reductionist in its orientation. So really there's a lot of laboratory science, and even in clinical science, there's an effort to reduce causality to A causes B, which really doesn't work in the traditional world medicines because there's an understanding that all conditions are multivariable, and we look at all those variables simultaneously. And when we create a treatment protocol, we create something that's multi-target. So we're not interested in isolating the one thing that works. We will administer all the treatments that work simultaneously, and we're looking for something like synergy. They all build on one another. So,
okay, I don't want to interrupt you, but and that is probably going to be a separate video in and of itself. But I do want to nail that down a little bit. So let's say someone is sick or they are unwell, and instead of saying, "Aha, you have X," well, yeah, you might have X, but it might be caused by this symptom, this symptom, this symptom, this symptom, and then. So you're trying, it sounds to me that when you're putting your treatment plans together, you're looking at a whole host of things.
It's very holistic. So in most traditional world medicines, there's a concept of a constitution, what the person comes in with constitutionally. These are kind of their strengths and weaknesses physiologically and psycho-emotionally, and also their kind of proclivities. What might they gravitate towards in terms of behavior or habits? And so we first develop an understanding of that. Then we develop an understanding of their imbalance. How far and in what ways and directions have they deviated from their original constitution? And the sort of treatment protocol idea is that you use whatever therapies, modalities, methods, paradigms are available to get that person back to their original constitution, because the constitution represents that person's baseline state of health. So that's kind of more complex than just Western biomedicine will go and say, what are your symptoms? Let's figure a way to either eradicate or suppress these symptoms. Symptom suppression is not something that is really considered desirable in traditional world medicines. We would rather address root cause so that the symptom is eradicated and it doesn't return, rather than symptom suppression, because oftentimes symptom suppression, the symptom will come back, sometimes with more, in a more virulent manner, or it's just kind of lying under the surface waiting for its opportunity. So we're very interested in resolving and regressing disease rather than just treating symptoms.
Okay, so not just the symptoms. And I can think of a whole host of things where that methodology would apply to. Because, you might be failing in school. Why are you failing in school? It might not just be the fact that you're not studying. There may be emotional issues that are keeping you from focusing. There could be noise where you're trying to study. So like you said, you've got to look at the entire picture. And that could help you. You could be having financial problems. Well, let's look at the whole picture.
Sure, absolutely.
And you're coming up with a treatment plan. So now, do you all, it's up to you. I was just going to throw out X university. I don't know if you want to mention the university and the medical system that you're part of, but it's in Washington. It's very large. It's very prestigious. When you all, is it ethical for you to talk about like the kinds of patients that you, I mean like cases, not patients, but do you work with cancer patients? Do you work with, I don't know, name an ailment that you all deal with?
Right. So let me just say, integrative healthcare is usually team-based, collaborative care. So you might have, a number of differently trained providers. For instance, you could have a Western biomedical doctor, an Ayurvedic doctor like myself, a traditional Chinese medicine person, maybe a massage therapist, maybe you would have a botanical medicine expert. So you would choose from this array of paradigms, all the providers and practices that would be most beneficial to the patient. So you wouldn't try to stick within just one medical science, but you're going to draw the best of everything for that patient. So that's one way to look at it. And if someone is just coming for Ayurvedic medicine, it's similar in the fact that I would choose whatever methods are available that would benefit them. But in both cases, you see the full spectrum of patients. Ayurvedic medicine is a system of primary care, just like Chinese medicine is and naturopathic medicine is. So these are available for all stages of illness, types of illness, stages of life.
Now, the other thing that you're too modest to say is basically you're in a job where you're not only helping people, but every day you're learning.
Oh, sure.
You're learning something new. You're like, and tell me if I'm wrong, but it sounds to me like, you'll come into the office, you have a meeting with a team, a case will be presented, and there'll be this professional, this professional, this professional, and you'll all look at it, and you come up with a plan to help that person. But as you're coming up with the plan to help that person, you're learning from the other people in that room.
Sure, absolutely. So there's a lot of what I would refer to as epistemic humility involved. You've got to be willing to consider other types of science. So epistemology is knowledge, right?
Yes.
But when you have knowledge humility towards other systems of knowledge, that means you're open, you're curious, you want to learn always and keep updating your skills and understanding. And that's the best way to be a scientist,
yes,
is to have humility toward all forms of knowledge and be willing to learn from all paradigms. So it's true that in most of the clinics I've worked in, we've had kind of a weekly meeting where we would workshop specific patients, but also we might work on patients and just exchange information through the electronic medical record or whatever the system for sharing information is, and call each other and talk about it. I also teach. I've done research. I've been an administrator. So it's not just clinical care that I do, but it's one part of what I do.
Okay. Now, before we wrap up, is there anything else you want to say?
No, I think we've covered a lot of territory.
Okay. Well, first of all, thank you. Yeah. And I can't thank you enough. If this is the kind of content you really want to see, content where people aren't yelling at each other, people aren't calling each other names, where people are learning and we're about learning and about care, please like and subscribe. And thank you very, very much for tuning in. Dr. Rioux, thank you.